Hello, I'm Dr. Mark Besancon, and this is your pet tip of the month. Today we're going to be talking about allergies. There's actually three big types of allergies that occur in dogs and cats. One of them is food allergies, where they're allergic to their food. The other is flea allergy, where they are allergic to fleas, the actual flea bite. And the third one that we're going to talk about today is called atopy, or allergies in general, seasonal allergies or non-seasonal. They can be broken down into those two different categories, depending on whenever they flare up. If they flare up more in the summer or winter, but they're calm the other two times, then they're seasonal. If it happened year round, they're considered non-seasonal. They just happen all the time. A couple of things that you want to look for in your pet that may kind of clue you that they have allergies. Red, irritated skin. A lot of times these guys, their skin will get really red. They may lose a little hair as well, and so that's one big thing. Another big thing that you're probably going to notice right off the bat that's going to key you off is scratching. They scratch all the time, or whenever they're relaxed. They'll sit there and scratch at their axillary or armpit regions. They may lick a lot, lick their feet. If they're laying there and they're licking on their feet, that's another big sign of allergies. And so that is something that you want to watch for in trying to determine if your dog may or may not have allergies. Another thing that may start happening is they may get irritated eyes. Their eyes may turn really red. That's another sign that we may have allergies. As the allergies progress, secondary things that may happen, they may have an odor to their skin. They may have some bumps or pustules on their back or body. That's another sign that are some complications to secondary to allergies that you may want to look for as well. How do you diagnose allergies? Typically clinical signs. We get a good history from the patient and the owner, and we see what's going on, and you diagnose it on clinical signs. Allergy testing, there is allergy testing out there. Many referral clinics will do this. They actually inject a lot of the different things that dogs could be allergic to: pollens, grasses, dust mites. There's several of them, several different pollens, several different trees and grasses that they will test for, and they can determine what that your dog or cat may be allergic to as well. And then formulate a protocol to help treat that, which we'll talk about later. As the allergies progress, some problems, secondary problems that may occur: skin infections. Skin infections, the skin gets compromised due to the allergies. Bacteria, the fungus that's on the skin overgrows, and you'll get pustules, little pus pockets and things like that. It may get a moist skin infection on there. That's a complication. Another thing is ear infections. Ear infections, the dog may scratch at his ears, or cat, and there might be a raging infection going on in there. Fungal, bacterial, other thing is mites, but allergies can sure cause secondary ear infections as well. And so things to diagnose that: skin scrapings, tapings, things like that to rule out mites or mange, and then a taping to maybe see what kind of bacteria or fungus is growing on the skin. And then ear cytology, we actually look in the ears, we take a little swab, and you diagnose and see what kind of bacteria is in there, and then treat accordingly. Treatment: how do you treat allergies? You don't really cure allergies, you manage these guys. You can't cure allergies. Antihistamines, steroids, those are two big medicines that we use to give your pet relief. All it's going to do is give them relief. It's not really going to cure anything. There are some other drugs out there that act a little differently that your veterinarian may prescribe that help with allergies as well. Topical shampoos help quite a bit. Oatmeal shampoos. If your dog has a skin infection, they may prescribe a medicated shampoo that you follow with an oatmeal shampoo. There are some shampoos with cortisone in them, which is a steroid, which may help with itching. Different things like that may help with to help treat or manage the allergy and secondary problems. If there is an infection in the skin, in the ears, antibiotics, antifungals, if they're warranted, those will be prescribed. Ear meds in general, if the eyes are really irritated, maybe some eye medicine as well. You need to take these guys to your veterinarian and have a good exam done so that they can evaluate them and treat them accordingly as to what problems they may have. How do you prevent allergies? There's really no prevention. If the trees are blooming outside and your pet happens to be allergic to the pollen that's produced, the best thing is to keep them inside as much as you can. Try to avoid the allergen, whatever that might be. You may never find out what that is. Allergy testing does help, but you may never know what they are actually allergic to. So the biggest thing is to just try to maybe key or find out, or if something does seem to, if they go out in the grass and they come back inside and they're more itchy or scratchy on their belly, you know, it may be the grass. So just try to find ways that you can maybe help reduce the exposure and give your pet some relief. That's going to help a lot with allergies. Like I said, it's not curable, but it's manageable for sure. And so if your dog is experiencing any of these signs of licking, scratching, and having any bumps or anything like that, definitely get them into your veterinarian, give these guys some relief, and get a protocol, work with your veterinarian to get these guys treated and feeling better. Have a good day.